Welcome back to Steel and Vance. Linda, it is official. We have referenced this story every episode of Steel and Vance since we began season 1, still searching for an answer on how to save lives of those who struggle with addiction in a time of a tainted drug supply.
I think it's 6 people a day in this province who are losing their lives. Everybody is desperate to come up with a solution that could everyone agree on? That's the problem.
Big.
There's politics and votes involved and money, and then desperate families saying, we got to keep people alive. Yeah. So it's the debate about safe supply and what do we do about it? We have our own thoughts, but we want to bring in the author of a book that was a national bestseller. It was called Overdose, Heartbreak and Hope in Canada's Opioid Crisis. Professor Benjamin Perrin is also a criminal law professor at UBC. Thank you so much for coming in.
Thank you for having me.
I know that you are an advocate for regulated safe supply. Why?
Well, unregulated drugs are the leading cause of death now, from ages 10 to 59. 10 to 59. I've got kids who are 8, 10, and 12, and we literally have children dying of those ages.
Yep.
These are from substances that are created by organized crime. Yep. That's what people are dying from, full stop. Here in BC, across the country, over 80% of people who they do the post-mortem toxicology, it's fentanyl. There's other drugs mixed in there, but that continues to be the common denominator. When I started researching this, I didn't even know what fentanyl was. It's not naturally occurring. It was created in a lab in 1959, and it was for palliative cancer patients who were dying. So it's literally a pain relief medication. If you've ever taken your pet to the vet in the last few years, last decade even or more, if you've had any medical procedure where you went under, chances are you've had fentanyl too.
Right.
But it was made in a professional pharmaceutical company. So since writing this book, I've had fentanyl. I had a medical procedure.
Really?
And there were 2 reasons why it was safe for me. And if you miss either one of these 2, that's where you're at risk of dying. Okay. So number 1 is I wasn't alone. There was someone who was there, and they're watching a couple things. They're watching if I'm, first of all, conscious or not. Then they're watching my heart rate, my breathing, and my oxygen levels. And if any of those start to go down, they can ease off what they're giving me, and if needed, give me naloxone, the temporary antidote to a fentanyl overdose. So that's the first thing, is not being alone. We know that people who use alone are substantially more likely to die. The second thing, though, is I looked over. It was a drip, drip, drip on the IV, and it was precisely titrated. They weighed me. They knew how old I was. They had their charts, and they give me exactly, we knew it was in there. So that's the second thing, that if it's missing in our communities, is deadly for people. It is unregulated drugs. So when we interviewed the Vancouver Police Department, the Victoria Police Department, we talked to everyone in this issue, everyone and anyone we could talk to who had anything to say about it. They told us that when they've done these drug busts in these labs in Canada, they found fentanyl mixed in kitchen blenders. Now,
oh my God.
The difference between a fatal and a non-fatal dose of fentanyl, illicit fentanyl, is grains of sand.
Right.
Grains of sand. So you never know what you're getting. You may be someone who has an addiction to opioids and been cut off by your doctor. That's happened a lot, and the evidence has shown that's increased people going to this illicit, unregulated market. Yeah. Or maybe you're at a bachelor party. We have real cases. These are made real cases in BC and across country. Go to the bachelor wedding party. Someone picks up some drugs. Not looking for heroin or fentanyl, but it's mixed in.
Yeah.
It's been mixed into every street drug that we have, imaginable.
We've all lost colleagues, friends, children of friends, as you mentioned. As the mother of a newly minted 16-year-old, this terrifies me. Yeah. And my only real message to my son and his group of friends is don't use alone.
Yeah.
If you're going to, because when we were experimenting as kids, if you did or you didn't, it wasn't like Russian roulette. No. And that's what you're talking about here. That 1 grain of sand, or that, how do we get away from it being an organized crime supply versus, the safe supply that seems to have a big slice of society saying, not on my dime?
Yeah. So bottom line is, how do we respond to this? So,
yes.
We're up to over almost 40,000 Canadians have died.
I know.
Okay, that's just since 2016. So it's a new problem, but it's not new, right? It's been around for almost a decade now, when the numbers of dying started going up like this. So what we do in our research is we look for 2 things. We look for things that are compassionate and evidence-based. That's what we're looking for. And that means we need, first of all, safe places for people to use so that they're not alone. So instead of having one overdose prevention site that becomes a lightning rod, they're disseminated in the community. If you need access to use somewhere, you're being watched, you go. Now, look, I didn't know what an overdose prevention site was. I'd never been to one, and it sounds kind of wild to me. And I went in, and basically the only thing that happens, people bring the drugs in they're going to use anyway, in their homes or in a back alley or in their cars. And if they literally like hit the ground from an overdose, someone comes over, gives them that naloxone that I would have got in the hospital, and gives them rescue breathing so they don't get brain injury. That's all that happens there. Oh, and they'll give them a clean syringe so they're not using someone else's and getting communicable diseases.
Yeah, I mean, we would argue that there have been issues where overdose prevention sites tend to act like a magnet for
the lightning rod
disorder.
Yeah.
But the one thing that really gives me pause around when you talk about a regulated safe supply. I'm good with the hydromorphone and those kinds of things, but it turns out that users say that's not strong enough.
Right.
I want to have fentanyl, I want meth, and I want government to provide those things. And I'm thinking I'm not okay with government getting in the business of making straight strength fentanyl and meth and giving it out to users.
Well, you're okay with the organized crime doing it then? Right?
No.
So I'm not putting you in a box. There's better ways, right? There's better ways.
I guess I wonder, how do we prevent the next generation of addicts?
So there's two issues here. One is people dying, and then which is the unregulated drug crisis of people dying.
Yeah.
And then there's concerns about addiction.
Yeah.
These are two different things.
Very separate.
Yeah. And so let's talk about both though.
Yeah.
So to start with, I think our top priority right now is to save lives. That's what I think should be our top priority. And while doing it, to not make the problem worse.
Yeah.
Right? So how do we save lives? Well, we need to provide rapid access to treatment on demand. We're not doing that in BC or anywhere in Canada.
100%
There's talk about forced treatment. Forget forced treatment. Let's get people access for free evidence-based treatment. So we need to have that. Have safe places for people to use. Treat this as a health issue, not a criminal one, okay? But we still have this proximate cause is this unregulated substance. So it has to be substituted. People who have a substance use disorder are going to use these drugs. They are. They need to have an effective substitute. There's also people, and that's about 80% of people who are dying, are people who are regular users. How do you provide that? Well, ideally, it needs to be an effective substitute, right? So imagine if someone had an addiction to like whiskey, and there's a regulated supply, but if it was poisoned, which can happen in any of our food or supply chains, what do? They put a halt on it, and they pull it back, and they would provide something else. Imagine if we had a program in the meantime where we said, we're going to substitute your whiskey for Bud Light.
Right.
That's not going to work.
No.
So
someone's going to go searching on the black market for whiskey.
Yeah, or you're going to get your moonshine, you're going to sell
Whatever,
your Bud
you're gonna make
Light,
it at
right?
home. Yeah,
so this is the diversion issue, right?
Right?
So if we're not providing people with an effective substitute, if someone has a cocaine addiction and they're getting this toxic cocaine, they need to have a source. Now, who pays for it? Like, we can talk about that, but there needs to be a legal source. So there's a number of different models. One is a legalization model where people can buy and sell it like alcohol and cannabis. Some people support that. That's not the support. I don't support that approach at this point. But the support really needs to be behind a regulated supply. So there has to be a safe place you can get it and you know what's in it. People tried doing this in Vancouver recently, the Drug User Liberation Front. They paid for them. So to your point here about you don't want to pay for it, well, they were paying for their own. And they were testing the drugs, and they were providing them to people, and they did it in the open. They asked for Health Canada to give an exemption. They were working with Vancouver Coastal Health and others. And in response to political pressure, the VPD went and arrested those two people who were leading that group. Now, for a better part of a year, no one in that program, there's no evidence that anyone in that program died of any of those drugs that were being tested. So people who were using cocaine or meth were getting cocaine and meth. They weren't getting cocaine and meth mixed with fentanyl and benzodiazepines and tranquilizers and all this.
Yeah.
So this is the part about saving lives. And look, we've always had in BC and elsewhere people who died of pharmaceutical drugs. You can look at the charts on the coroner service. It was below all of the other causes of death, though. What has skyrocketed is not pharmaceuticals, it is unregulated drugs. And there's no evidence that diverted hydromorphone is contributing at this point to these deaths.
So if I could drill down, because we could really talk to you all for all hour and then some on this, because it is fascinating, because it's been so politicized, because there is so much fear around this. Is the first domino that should fall the one that takes the marketplace out of the hands of organized crime?
Yeah, I actually think we need to do all these things at once. Like,
okay.
I don't think it needs to be staged. I think we do rapid access to treatment on demand. We make more, not less, overdose prevention sites. Like, as you said,
it's not
just one spot, right?
Yeah.
And the other thing is, we need to make these a regular thing. It's a healthcare. It's a basic healthcare. You're talking about giving someone oxygen if they're on the ground passed out. I mean, if you're going to have judgment for someone who's using, illicit drugs, saying, well, you figure it out for yourself. I mean, we have like defibrillators in our community now. We're not going around pointing people, hey, because your lifestyle, you shouldn't have had that extra cheeseburger. Like, we're not doing that anymore with healthcare issues.
You smoke, I'm not going to use the defibrillator on you.
I don't think there's the political will to do any more than we're already doing, and BC has done more than other provinces. We've seen decriminalization. They're now going in Oregon that the 3-year market's not working. More people are dying, which cycles back to your point about it's the supply being tainted. But I don't think that any government is ever going to push this across the line because they're worried about not getting voted back in.
Well, what a horrible, I agree with you, that's a horrible commentary on our society. Yeah. That's one of the reasons I'm here and not just like clicking away on Facebook, though, and why we do events and talk to people. That's why groups like Moms Stop the Harm and people who are in recovery are so powerful. What changed my views on these things was actually hearing those folks, right? Hearing those stories. These are parents. One of the moms in Montreal a week and a half ago spoke at one of our events, and her daughter was in second year at the University of Ottawa, studying international development, wanted to go to law school. Okay, these are like the students that I teach. They're bright young people. Yeah. Her mom had no idea that she was using unregulated drugs. This is not about the downtown east side and people on the street. This is not about that only. Yeah. It's actually mainly about the over 100,000 British Columbians who are at risk of dying from unregulated drugs. And we are, as a society, choosing to follow, political backlash, right-wing pundits, YouTube clickbait videos instead of following the evidence. Yeah. Well, yeah, Mr. Polyev has lied on this issue. He said that people were dying because of safer supply.
Rallies is based.
That's a total lie. Yeah. And the fact is that this doesn't limit itself to political ideology. There are plenty of conservatives who've died of unregulated drugs, and it's heartbreaking to hear this continue to go on. So, I'm not giving up. The BC Coroner is not giving up. Lisa Lapointe has called for the expansion of safer supply, including through compassion clubs. So, like, getting to the addiction question you were bringing up earlier, compassion clubs are really interesting as a model, like DULF, because they're groups of people who are already using substances. They know their membership. They are not, going around the street offering people stuff. It's for them, and it stays within the group of people, and it's tested and it's regulated, and they're living, right? The fact is that we do need to have those conversations, and what you were sharing a minute ago, absolutely, don't use alone. The evidence shows that if you do the scare tactics, those backfire, and
no one's coming out asking for help if they're going to be tagged as someone who doesn't deserve help.
Or it's illegal, or you're going to lose your job.
Right.
Well, you are pushing me. I mean, I want to be on board, and I almost am, but I'd like to see the devil's in the details.
Yes.
I'd like to see it rolled out in a way that makes sense. But thank you for coming in, because we could talk about this.
And come back again.
Yeah.
I'd love to.
And your new book, just out in October, is called?
Indictment, the Criminal Justice System on Trial. And, we interviewed people who were survivors and victims of crime, people who are incarcerated, and they're the witnesses as we put the justice system on trial and talk about what we could do differently. How could we have a safer society for everyone?
You're coming back in to talk about that.
Circling back in season 2. We'll see you in 2024 for sure. Thank you.
Thank you so much.
Thank you.
Appreciate it.
Thanks.
Moving the meter.
Moving the meter.
Oh no! I mean,
I appreciate you saying that.
I have some concern.
That's what our kitchen table.
Learn more.
You just exemplified what our kitchen table is about. You have to have your ears open. You have to learn from the fact-based piece. Okay, we've got lots more coming up on the show.
Yes,
including.
But 'tis the season for cyber scams. Yeah. I'm getting hit from every corner right now. Keep your eye out for fraudsters trying to steal your money, your identity this holiday season. We've got some tips on protecting yourself from scam artists when we come back.
We do, and we're going to show you who's in on our viewing party. Dawn and Brenda in Nanaimo. Thanks for sending in your picture.
Jerry and Russ in Burnaby. Hello.
And Harmina in Surrey. There you are.
Also James and Daisy in Chemainus. Thanks for watching.
Viewing party at CHEKmedia.ca is how you get involved. And stay tuned at the end of the show. Someone's winning a fabulous White Spot gift certificate.